Hello, my name is Sharon. I'm going to talk about the speech disorders in diseases of the nervous system. We have aphasia, dysarthria, and anarthria. Next. So, speech disorder or speech impairment are types of communication disorder where normal speech is disrupted. The main parts of the brain involved in language processes are the frontal area, located in the left frontal lobe, which is responsible for speech production and articulation. And also we have the wernicke areas in the left temporal lobe associated with language development and comprehension. So aphasia is a neurological disorder caused by damage to the portion of the brain that are responsible for language production and processing. It may occur suddenly or progressively, depending on the type and location of brain tissue involved. We have five broad categories. We have Broca aphasia, we have wernicke conduction, transcortical, and global aphasia. The Broca aphasia is the damage to the inferior left frontal gyrus, which are Brodmann area 44 and 45, including the underlying white matter, insula, and the basal ganglia. It's characterized by a partial loss of the ability to produce language, like spoken or manual or written. Although comprehension generally remains intact, a person with expressive aphasia will exhibit a thoughtful speech. The next one is a wernicke aphasia. It's the damage primarily to the broad men's area 22 at the junction of the temporal, parietal, and occipital lobes. This is the left auditory association complex. People with this chronic aphasia may speak in long, complete sentences that have no meaning, adding unnecessary words and even creating made-up words. The conduction aphasia is caused primarily by damage to Brodmann area 39 and 40. They cannot repeat sentences accurately and they have trouble naming pictures and objects. The transcortical aphasia, it can manifest itself as a transcortical motor or sensory aphasia. The motor aphasia is caused by damage to the left dorsolateral frontal area. This is area anterior and superior to Broca's area. Transcortical sensory aphasic have fluent speech with impaired comprehension, very much like wernicke aphasic. But unlike wernicke aphasic, they can repeat sentences accurately. Transcortical sensory aphasia is caused by damage in the area of the junction of the temporal, parietal, and occipital lobe. Some symptoms they can see that they have word finding difficulty. The speech consists mostly of content words such as nouns, verbs. They have no articles or prepositions, and they have difficulty initiating speech and impairment in writing. And we have the global aphasia. It like implies it's everything. It englobes everything. The disability of Broca, wernicke, conduction, all combined together. They cannot comprehend or repeat sentences or speak meaningfully. They do, however, speak inexpressive and can recite such things as the days of the week. Global aphasia is caused by damage to anterior language region, the basal ganglia and insula, the posterior region, the superior temporal gyrus. Typically, this large amount of damage is caused by infarct of the middle cerebral artery. The next disorder we have dysarthria. It's a motor speech disorder in which the muscles that are used to produce speech, like the superior lingualis, inferior lingualis, vertical and transverse lingualis, are damaged, paralyzed, or weakened. The person with dysarthria cannot control the tongue or voice box. It's caused by the damage in the area important for motor aspect. And these are, we have like typical types. We have the flaccid dysarthria. It's due to the damage of cranial nerves, the fifth, the seventh, and the ninth, 10, and 12 cranial nerves, and also other region of the brainstem and midbrain. And the second one is spastic dysarthria. It's due to the damage of motor region in cortex on both sides of the brain. The third one is ataxic dysarthria, due to the damage of pathways that connect the cerebellum with other regions in the brain. We have hypokinetic dysarthria due to Parkinson's disease. And the last one, we have hyperkinetic dysarthria. It's due to damage of the basal ganglia. So we can see the symptoms. We have slow or slurred speech. We have rapid speech that is difficult to understand, difficulty in moving the facial muscle or the tongue. We have monotonous speech, uneven speech volume, abnormal speech rhythm, inability to speak louder than a whisper or to speak loudly. The other disorder is anarthria. It's a severe form of dysarthria. It's a partial or total loss of articulate speech resulting from the lesions of the central nervous system. And it can be caused by brain damage. It can also be caused by conditions that are present at birth, such as cerebral palsy or muscular dystrophy.